I'm Dr. Brian McKay of Core Health in Darien, and I want to demonstrate for you today one of the most comfortable adjustments. The chiropractic treatment is called an adjustment. What we're looking to do is correct spinal subluxations. What we're going to do is we're going to use a tool called an activator. The activator allows us to use a specific amount of force, and you probably don't think it will do much, but by pushing that, it happens a lot faster than my hands, so we're able to achieve the correction virtually painlessly. So we begin our analysis here at the foot, and I look and see that the right leg is shorter than the left. And what happens is I bring it up, and what that tells me is we have what's known as a right pelvic deficiency. The right short leg goes long, and we call that position 2. So what I'm going to do here is I'm going to come up here to the pelvis. I'm going to correct it using the tool. I come back down here and raise it up. Now we have leveling in both position 1 and this is called position 2. So now I know we've corrected it. We're going to use isolation tests. So I'm going to ask you to please put your right hand on your low back for me, please. And here we have another subluxation L5. So what we're going to do now is take your hand down, please. Come in. I'm going to push the instrument right here. And I ask you to place your right hand back on your low back. Now the legs are level in this position. And they're level in that position, so I know that we're good. We're going to work our way up the entire body. Place 2 hands on your low back, please. I should tell you that the motion of putting 2 hands on your low back ties into a spinal segment called L2. And that's even in both positions, so we basically leave it alone. So this technique tells us when to do something and when not to. Bring your arms down and bring your right arm above your head, just the right arm. And here we're doing is we're testing for thoracic number 12. You see that change. Okay, the right leg is taller, much taller in position 2. It's kind of even position 1. So what I'm going to do is I'm going to come up over here, and T12 is about there, and make the correction. As you can see, it's very, very comfortable, but also very effective now that the legs are balanced. I'm going to ask you to bring 2 hands above your head. I'm going to scan the body, so we're up into T8 now. That's level, and level again, so we leave it alone. Bring both arms down to your side. I'm going to ask you to turn your head to the right. Now, when this happens, this isolation test is for thoracic number 6. It's even, so we leave it alone. Elevate your right shoulder up, please, keeping your head turned. Bring it down. Shrug your shoulders, and release. Now we're at thoracic number 1, which is the base, and we see this again, so we're going to come in, and we're going to push right there. I'm going to ask you to shrug your shoulders for me and release. Repeat the isolation test for the ones that are positive. Now you can see the legs are even. We're all good. Put your head in the middle, please. Now we're testing for cervical 7. That doesn't seem to be a problem. Lift your head up. Cervical number 5. Bring it down. And again, no problem there, which is good. Tuck your chin to your chest and release. And now all of a sudden we're at C1, so at the very top of the spine, and that's the last movable vertebra. I'm actually going to come down a notch, right here, and now tuck your chin to your chest one more time, and release. Okay, level, we're all done, the adjustment's complete, subluxations are taken care of for now at least, and we're going to take the patient out. Once again, I'm Dr. Brian McKay of Core Health in Darien. I want to thank you very much for watching.